I'm Dr. Charles Lee. I'm the consultant plastic and cosmetic surgeon here at the Sabah Medical Center in Kota Kinabalu, Sabah, East Malaysia, very often referred to as the land below the wind on the beautiful island of Borneo. I have been practicing plastic surgery for the past 20 years, and my initial training was in the Edinburgh Hospital in Cambridge, followed by Frenchy Hospital in Bristol, and I did my burns training at the Bangor General Hospital in Edinburgh, Scotland. I'm a fellow of 3 Royal Colleges of Surgeons of Edinburgh, Glasgow, and the College of Surgeons of Ireland. I'm also a member and the past Vice President of the Malaysian Association of Plastic Aesthetic and Craniomaxillofacial Surgeons. Aesthetics Millennium is a practice here that offers a wide spectrum of an integrated approach to plastic and cosmetic surgery. We do surgical procedures involving the face, the body and the breast, as well as non-surgical procedures, bringing in state-of-the-art, high-tech procedures for skin tightening and facial rejuvenation, including laser and light technology. See, plastic surgery, as I believe and take it, is very much a marriage between beauty and the science of medicine. We have advanced so much in technology today, and even though I was trained in the United Kingdom nearly 16, 17 years ago, but the science of medicine is the same, but we have developed skills over the years that give us a much better aesthetic result, and more predictable and safe, long-lasting results can be obtained. So, for example, I have a passion for body sculpting, especially in a very challenging area like the back. And we can see results in about a week after liposuction, because we not only do the procedure, but we follow up with deep tissue skin tightening, collagen, septate tightening, sonophoresis, and all these advancements in technology certainly advance our results and how we obtain them. On an average, I perform about 250 to 280 surgical procedures and another 120 to 150 non-surgical procedures. So that takes us to about nearly 400 over cases a year for a total year. And of course, in our practice, patient selection and realistic expectations are essential in the quest for a pleasing and aesthetic result. We do spend time in counseling the patient to make the right informed decision as to which procedure is right and adequate to get a good result. I've been very fortunate and blessed that the same surgical team of doctors, anesthesiologists, staff nurses, theatre trained nurses have been with me since 1990, which is about 16 years now. So we work as a team. And the philosophy is to be safe first. Safety and commitment to care is our primary goal, so that we have a very good and happy patient at the end of surgery. I think one of the key goals in surgical training, and certainly with years of experience, is when not to operate, or how to choose the right surgical procedure to give you a result that you know can be attained. For example, patients may come in and want a liposuction procedure to be done when they're actually candidates for a tummy tuck. And so I think the difference between a good and a great surgeon is when not to operate, and the choice of the right procedure. You know, cosmetic surgery is real surgery. And surgery is a serious undertaking that needs careful consideration. It's not something that you just opt for and just pick up the phone and just do it after surfing the internet. No. I think every time I take the knife, there's a risk involved. And so considerable time is taken between the patient and the surgeon to come to an informed decision, so the patient knows all the risks and the complications that are involved. I use textured gel implants for most of my breast augmentations or enlargements. And there is no routine or a fixed procedure for breast enlargement. I think that's very tailor-made. For example, if a patient has a very indistinct breast fold, then I would opt for a subpectoral or under the muscle placement of the implants. But more often than ever, on an average, I usually place them above the muscle. But then again, the choice of the procedure depends upon what the patient requires. You know, in the philosophy of our practice, I personally believe that appearance is the most public part of the self. And what I love most about my work is the privilege and the opportunity to be able to expand the opportunities in one's life by giving them better self-esteem, more self-confidence, helping a patient on towards achieving her fullest goal and potential in her life. When a patient is able to say, thank you, Dr. Lee, I feel that my surgical training and professionalism has come full circle. There is a verse in the biblical scriptures that goes like this in Psalm 139 verse 14, which says, I praise you because I am fearfully and wonderfully made. And so to have a great heart and passion for life is what I believe makes a woman gorgeous as a whole, from within and from without. And certainly in my practice, I aim to achieve this to the fullest potential, both in the patient and in my surgical training and practice.